Machines are increasingly handling our daily tasks, but what happens when they start to fail? Picture this: you're in a hospital, depending on automated systems designed to enhance efficiency. What if those systems are concealing alarming stress signals that could jeopardize patient care? As healthcare automation rises, many overlook the lurking risks. You might think these robots are flawless, but they can emit stress signals that threaten lives. It's alarming, isn't it? Consider a nurse overwhelmed by a machine that complicates rather than assists. This stress can lead to catastrophic mistakes that could be life-threatening. Most people are blind to this danger, and that's the real crisis. Now, think about your reliance on technology for critical decisions. What if it misinterprets data? Every beep and whir, intended to help, could actually indicate a brewing disaster. This dependency fosters a robotic workforce that risks losing the essential human connection it was meant to support. Have you felt unease when machines make choices for you? That discomfort is a warning signal. Imagine a doctor doubting a robotic diagnosis. It's not just about trusting the technology, it's about the emotional toll on healthcare professionals. And let's not forget the patients. A robot malfunction can have dire consequences. A misread scan could lead to wrong treatments, heightening stress for staff and families alike. This is a reality many choose to ignore, but it's a hidden threat in our growing reliance on automation. We must recognize these warning signs. Awareness is crucial. Envision a healthcare system where workers are trained to spot stress indicators not just in machines, but within themselves. As we advance into this automated era, let's prioritize the human touch. Balancing technology and empathy is essential. Imagine a future where machines enhance our capabilities without replacing our ability to care. Reflect on this: our dependence on robotic workforces is reshaping healthcare in unexpected ways. The next time you hear a machine hum, ask yourself what's really happening beneath the surface. It's time to confront these overlooked dangers before they become our new reality. Imagine waking up to find that the machines designed to help us are now endangering our lives. It may sound like a plot from a sci-fi movie, but this is the reality in our healthcare systems today. The shift towards robotic workforces in healthcare isn't just a trend, it's a ticking time bomb. The hidden dangers of relying on these automated systems are gradually infiltrating our daily lives, and the more we depend on them, the less control we have. Consider a robotic surgical assistant making a split-second decision in the operating room. Sounds efficient, right? But what if that robot misreads data or goes offline during surgery? It's not just a minor error, it could be a life or death situation. Many believe that automation guarantees better outcomes, but there's a hidden cost to that assumption. Beneath the shiny surface of innovation lies a reliance on algorithms that can miscalculate or systems that can fail. Often overlooked is the increasing pressure on human workers to manage these machines, pushing them to their limits. Now, picture a doctor in a bustling hospital relying on robotic systems for patient care. They trust these machines completely, but what if that trust is misplaced? A single glitch could lead to misdiagnosis, putting patients at risk. This issue extends beyond surgery. From diagnostics to patient monitoring, robots are taking over roles once held by humans. With each task they assume, we risk losing valuable human intuition and empathy. This isn't just about technology, it's about the essence of care itself. As we grow more comfortable with automation, we might overlook the necessity of constant human oversight. Complacency can escalate risks like an unseen fault line ready to snap. Are we truly prepared for the consequences when automation fails us? Yet, there's a glimmer of hope. A balanced approach to integrating robotics could provide the best of both worlds. Imagine robots assisting doctors, enhancing their abilities rather than replacing them. Wouldn't that make the process safer? Let's not ignore these potential dangers. Consider how often you rely on technology in your daily life, especially in healthcare. As we embrace innovation, we must also remain vigilant. What if the future of healthcare involves robots working alongside humans? That's the vision we should aim for. So, the next time you hear about a new robotic system, ask yourself what's the cost of convenience. And as you ponder that, remember to stay curious and question the technology around you. Your health may depend on it. Imagine a world where machines make crucial decisions about your health. Surprising, right? This isn't just science fiction, it's happening in hospitals today. While robotic assistants promise increased efficiency, they also come with hidden dangers that many overlook. Our growing reliance on these machines could fundamentally change healthcare as we know it. Picture this: you're in a hospital, and a robot is deciding your treatment plan. Sounds efficient, doesn't it? But what if that robot makes a mistake due to a glitch? The consequences could be severe, yet few are discussing these risks. You might think, but technology is always improving. That's true, but there's an unsettling reality beneath the surface. The more we depend on robotic systems, the less we trust our healthcare professionals. Imagine a doctor second-guessing their instincts because an algorithm suggests something different. Have you ever considered how much data feeds into these systems? It's staggering. Yet, the human element, empathy and understanding, often gets lost. Robots can analyze data, but can they comfort a worried patient or sense fear and joy? The answer might surprise you. As we embrace more automation, we risk sidelining our medical staff. They are relied on less, and their skills may dull from lack of use. Picture a once celebrated surgeon now feeling obsolete as a robot takes center stage. What does this mean for the future of medical care? It gets even more complicated. When robots make mistakes, who's held accountable? Is it the hospital, the manufacturer, or the programmer? This uncertainty could lead to legal battles, leaving patients caught in the crossfire. And let's not forget the financial implications. Hospitals investing heavily in robotic systems may cut costs elsewhere, including staff. Fewer hands on deck could mean less personalized care. Would you want to be a patient in an understaffed hospital where robots are in charge? Before you dismiss these concerns, consider this: you're in a waiting room filled with anxious patients. The atmosphere is thick with uncertainty. Suddenly, a robotic voice announces a delay caused by a system error. How would that make you feel? Alone. Vulnerable. We need to address these overlooked dangers before it's too late. Finding a balance is essential. Embracing technology does mean we should abandon the human touch that makes healthcare truly effective. Health safety, payer, patient, pay, payer, payer, shoot you, payer, payer, payer,